Okay, hello and welcome everyone to the third Mind Behaviour Research Group Behavioural Measurements webinar, hosted in collaboration with the Centre for the Study of African Economies at the University of Oxford. I'm Mahreen Mahmud and I'll be moderating the webinar today, in which we will be discussing ways to ask sensitive questions that may be susceptible to biases if asked face-to-face. Before I tell you about the format of the webinar, let me mention here the Measurement Matters posts that the Mind and Behavior Research Group runs. The link for this is displayed as the first bullet on the screens in front of you. These are posts on various behavioral measurements, including one of the methods that we will be discussing today that can be used to address sensitive questions. In terms of the format of the webinar, we're going to invite the two panelists to give brief presentations introducing the topic. We will then open it up for questions and answers. This is meant to be an interactive webinar, so we really encourage you to please participate by posting your questions in the Q&A box. We will then unmute you and you can ask your question live. If for any reason you do not want us to unmute you, please let us know by writing this next to your question, and we will ask your question on your behalf. So let me begin by introducing the first speaker, Claire Cullen. Claire recently finished her DPhil in public policy at the Blavatnik School of Government at the University of Oxford, where she will soon be starting as a postdoctoral researcher joint with Young Love, which is a youth-focused NGO based in Botswana. Claire works on topics related to intimate partner violence, gender norms, and education, and has done several field projects in Nigeria and in Rwanda with the World Bank. Most importantly, Claire has thought very hard about asking these sensitive questions, particularly in the context of intimate partner violence, and has a really interesting methods piece comparing various topics. So we have somebody who's perfect for the topic we are discussing today. So thank you so much, Claire, for joining us. And it's over to you. I'll stop sharing my screen and you can start your presentation.
Thanks a lot for having me, and thanks to the CSAE and Mind and Behavior Research Group team for hosting this webinar. So I'm just going to start off with some context setting about when you might want to think about these kinds of issues and misreporting a bit more systematically. So I guess in an ideal world, we have independent administrative data or observable or non-self-reported data, which is often not available for sensitive topics, unfortunately. And so these topics cover obviously a broad range of issues, but could include things like corruption, other forms of illegal behavior, your own political preferences, sexual behavior, mental illness, HIV status, intimate partner violence, which is mostly what I focused on, or even like how much income you make or the way that you're spending microfinance loans. And on pretty much all of these topics, we have evidence that the survey method that you use to measure these matters a lot for how people are reporting them. And so how do we think about the motivations for misreporting? So often these get lumped together under social desirability bias, but really it's more than that. And so people have broken this down into two main areas. So either you might be misreporting because of shame or embarrassment or some social norm that implies that there's a socially desirable or undesirable answer, or from a desire to avoid some repercussions. And this could be from fear of what might happen if people find out what you've said, or trying to get access to a program, or trying to avoid being audited by the tax department, for example. So a huge range of issues. And I guess ultimately, why does it matter? Like if there's some signal from the noise, then maybe we don't worry about it too much. But it matters if we're trying to understand the magnitude of a problem. So we want an accurate sense of the prevalence of the issue. And it also matters for trying to understand relationships. So if we get misreported data, it may be biasing the correlations that we have between variables, and that's how we're generating theory and understanding the world. And then also in terms of measuring impact, it matters a lot if we're trying to measure the impact of a program, and if misreporting is correlated with the treatment, then we might be getting biased treatment effect estimates. So we do worry about it. So I'm not an expert, I have to have that disclaimer, but I've thought about it a bit with JB, and we've worked together in Rwanda before. So there, you can use face-to-face methods and introduce like additional protocols to try and make people really comfortable reporting face-to-face. And then some other methods. So I'm going to talk about the list experiment next. Jean-Baptiste is going to talk about audio computer assisted self-interview, but there are also a bunch of other methods that you can Google and maybe less ideal in less numerate or literate populations. So these can include the randomized response technique, some other methods like the endorsement experiment or ballot method or vignettes. These kinds of things may be more appropriate for different kinds of questions that you're interested in. But really, we need more research on these. And so that's a good public service. If anyone was interested in doing research on methods, that would be really helpful. It's also worth thinking about the different ethical implications of these different kinds of methods that you're using. So list experiment. It's easiest to explain if I just give an example, but essentially the benefit of the list experiment, or also called the item count technique, is that it allows respondents to provide their answer anonymously. So that means they know that the data collector and anyone who has access to the data later on will never know what their answer was to that sensitive question. So it might address a couple of motivations for misreporting. So how it works is that I have my sample, I randomly, and I split it into two different groups. So I randomly assign group A to get a non-sensitive question, the list with non-sensitive issues that I'm not interested in. And then I randomly assign the other half of my sample to group B that gets asked the same list with the addition of that sensitive item. So I'm going to ask group A, how many of the following 3 things have happened to you in the past 12 months? Don't tell me which ones are true, just tell me how many. And the answer options are 0, 1, 2, or 3. And then you list the 3, you read out the 3 statements that are not of particular interest to you. And then the second group, group B with the sensitive item, how many of the following 4 things have happened in the past 12 months? Don't tell me which ones have happened, just how many, with the answer options between 0 and 4. And so because you've randomly assigned them, the only difference between these 2 groups should be the presence of that 4th sensitive statement of interest. And so you can just calculate the difference in means between the 2 groups, and that tells you what the prevalence of the sensitive item is. So group B, a mean of 1.8 items, and group A has a mean of 1.6 items. Calculate the difference, and the prevalence of that 4th sensitive statement is 20% in the sample. So just a few things to consider. Like all things in life, there are a few trade-offs. So the list method has been found when compared to an objective truth in the United States, that it has increased people's willingness to report compared to a direct question. And it also takes them closer to truth. So it has been found to do what we're hoping it does. And as I mentioned, it can address a couple of motivations for misreporting. Like if you're asking in other methods typically address shame, but this is one of the few methods that makes people's answer really anonymous. And then in terms of negatives, it does have higher variance typically compared to direct questions. And so that does mean you need larger samples, which means that if you are trying to measure impact in an impact evaluation, for example, it can be really difficult because you do have to split each treatment arm into the 2 different groups. And then another issue is that there's decent research that the prevalence that you get is quite sensitive to the list design as well as its success. So you really need to have like the right non-sensitive questions. And yeah, it is the results are sensitive to how you've designed it. So it means you need lots of piloting, and at the end it could still go wrong. So there's a few risks involved. And at the bottom, I've listed a couple of resources that people might be interested in reading more, including my own paper looking at misreporting and intimate partner violence. Yep, and I'll stop sharing now. Thanks very much. My mouse is misbehaving. Here we go.
Great, thank you so much, Claire, for that introduction. I'll now introduce our second panelist, Jean-Baptiste Muhoza, who is one of the managers of Laterite's data team in Rwanda. He's managed several of their key data collection projects on a range of topics, and most importantly, as Claire mentioned, he's implemented some of the techniques in field, so he will bring his perspective to this webinar. So thank you so much for making the time, Jean-Baptiste. It's over to you. If you could please share your screen.
Thank you, Mahreen. Thanks to everyone for joining this webinar, and thanks so much to the Mind and Behavior Research Group for organizing this. You guys did an amazing job. As Claire mentioned in the previous slides, there are a few techniques that can be used to measure sensitive topics. One of the techniques that, or method that she mentioned was audio computer self-interview. So I'm going to focus on this one. This is a technique that we used on some of the researchers implemented here in Rwanda, especially researchers were evaluating the level of sexual and gender-based violence in Rwanda. So this is a tool that we at Laterite found very useful, and I would like to share a few ideas of how this works. First of all, this is a tool that we allow respondents to complete survey themselves, facilitated by some electronic devices such as tablet connected to the headphones. So basically, all the questions and answers should be recorded and coded into those devices so that the respondent can listen to the questions by themselves and answer to those questions by themselves. So for sensitive question you know that sensitive questions are by nature very intimate. So using Akasi and combining it with the other privacy and confidentiality measures was something that we found really, really important, because it gave the respondent the chance to truthfully and comfortably express their opinions. So it was something that really improved the way response can be collected from the respondents. There are some benefits that we found when using the Akasi. First of all, this is a tool that maintains respondent privacy, especially because it provides an opportunity to respondent to listen to the pre-recorded set of instructions, questions, and choices using headset, and then give them the chance to answer to those by themselves. It does also maintain the confidentiality, especially because when administering this to respondent, we try to make the questions and choices as anonymous as possible. So one of the techniques that we use is to not have option and choices as written or as numbers, instead having them as images or colors, so that no one around immediately know what the respondent selected represent in the survey. This is a tool also that doesn't require high level of literacy, especially because we try to the best to make it something that is visual, rather than something that we may probably need to read or count. So when answers and choices are presented visually through different shapes and colors, anyone can use that tool to provide his answers. It's also a tool that is compatible with platforms that are used in electronic survey, such as ODK and SurveyCTO. So it can be used in our platform that we routinely use to collect data. A few hints when using Akasi. It's always good to have several texts before you confirm that you have a good recording, because this is something that is really, really that need to be taken into consideration. For example, if you change the question, you need to record again that question to make sure that the script that you have in the questionnaire is exactly matching with what you have in the audios. So to be able to do that, there's a few tips maybe I can recommend to people. Since this is a tool that we allow respondents to answer by themselves, that means that we need to be very clear to them, because no one will be around to explain them how the question, no one will be around to explain them in more details on the question that they are being asked and the answers that are being provided. So it's always good to make sure that questions, options, hints, and instructions are clear and well articulated. It's also important to make very straightforward instructions so that whenever the respondent hears the instruction, he immediately recognize what you are asking them to do. Also, it's really important to make sure that the recordings you are using are of good quality. So please, it's always good to go and record in a very quiet environment so that the server will not annoy respondent by hearing some background noises. I think I can stop by here as we wait for the participant for the question from the attendees.
Great, thank you so much, Jean-Baptiste. Before we move on to taking questions from the audience, we would like to do a poll. For those of you who attended our previous webinars, this is just a simple question asking you to record your location. So we really want to know where all you're joining us from. So Samir, if you could go ahead and please launch the poll.
Would you like me to stop the poll now, Mahreen?
I think, yes, most people have already responded. We have an overwhelming majority from Africa joining this time, about 41%, about 17% from Asia, and the rest from Europe, obviously because of the time difference. We have 2 from North America and 3 from South America as well, some early risers joining as well. Thank you so much. So before I take some of the questions, I have one question because I know, so I implemented Akasi in Kenya, taking help from Claire, and I asked her a lot of questions about practical tips, really. So of course, there is one, the technique and like how does it work and how should you implement it like theoretically, but then of course, taking it to an LMIC means being very, very careful about certain elements. And so if you could, both Claire and Jean-Baptiste, for both Akasi and List, share a few tips about best practices that you found from implementing it in the field, that would be great. So Claire, if you want to go ahead with List, maybe?
Yes, sure. So I guess it's one of the main things, and I have seen the List method go wrong before. It's quite complicated. It's very different to the standard survey questions. And Jean-Baptiste has done the List experiment too, so he should chip in if he has thoughts too. But I guess for low literacy and numeracy populations, let alone like people who are very literate and numerate, it's a lot to remember when you're getting read a list of questions and you have to keep in mind these long sentences. So essentially keeping track of your answers whilst making it private is an important thing to factor in. So Jean-Baptiste came up with a good strategy for the List experiment in Rwanda. He can talk about that one, I guess. In Nigeria, we found that when I was doing the List experiment there on intimate partner violence, women, it was very low numeracy, and so women could put up one finger. We asked them to put up one finger under their hijab anytime a true statement was read out, and that way they didn't have to count or remember. And they could, after the end of the List experiment, they could bring their hand out and show the enumerator so the enumerator could count how many fingers they'd raised. So that was one strategy we used. And then it's also, we built in a few questions at the beginning that would give the enumerator a sense of whether the respondent had understood the question or not. Yeah, so those are some tips, and JB might have other views.
So in Rwanda specifically, we also try to come up with a few techniques that can help people who are illiterate or who can't really understand how the List method works. There are 2 main techniques that we use to make sure that people understand and are really adapting themselves to the List method questions. One was using stones. So we will have a number of stones that is equivalent to the number of options they have to answer. Then we will ask that person to hold all the stone in one hand and hide them maybe behind the back. And whenever an enumerator says something that happened to him or to her, just hand over one stone to another hand. So in the end, we count the stones that were handed over to another hand, which will be equivalent to the thing that the respondent experienced. Another one, which is quite similar to what Claire was mentioning, was to use fingers. So the respondent will hide her hands maybe underneath the table. And as the enumerator goes through the questions, we will ask the enumerator to just raise one finger whenever the question that was asked, whenever option that was mentioned is something that he or she experienced. So in the end, we'll just count the fingers that the respondent raised, and we see that we know how many of the options that were mentioned really represent what happened to that respondent.
Great, thank you. That's a very helpful tip. Thank you for sharing these. We'll go to now the questions from the audience. If we could have the first one from Alina Oja, please. Alina, you're being unmuted. She's joining us from Basara. If you could ask us your question live, please.
Yeah, hi. First of all, thank you so much for the presentation. And I'm very much interested in this topic. I myself did like list experiment for my thesis. So the only thing that I'm considering is we cannot use like power. I feel like it's difficult to use power calculation to calculate sample size, given you may not know the true prevalence that already exists and things like that, right? So in that case, how would you decide on what's the right sample size for your study, for the list experiment in particular?
Thanks a lot, Alina. That's a super tough question. I guess all power calculations are a bit of art as well as science. So I guess I would suggest looking at that paper that I think came out last month from Blair, Kopok and Moore, and they talk about, like, in political science, often they find that the misreporting is not worth it given the additional variance of the list experiment. And so I've forgotten what they suggest, but like in a sample of 3,000, maybe you need like a 10 percentage point bias, I don't know what the baseline is from, to justify using the list experiment. Although so it depends so much on the level of reporting bias, because in Rwanda, where JB and I were working, we found much higher rates of misreporting than they had found in a lot of political science literature. So I don't know, I guess like all power calculations, do a few simulations, but that paper is a useful, has a good discussion on how you should think about the various trade-offs with sample size and likely reporting. So yeah, I'd suggest taking a look at that one.
Okay, great. Thank you.
Great. Thank you. Aditi Kadam, if you could unmute her, please, to ask a question.
Hi, thank you so much for organizing this. I've been interested in this topic and I've been kind of exploring this for a while now. But I guess I have like two main questions, one of which I have posted in the comments. So Claire, can you talk a little bit about how you designed the list questions? And especially, like, were you worried that the sensitive question might stand out? And in your opinion, what's the best way to design the list questions? And my second question is, what do you think about using the list experiment by using a different platform? So for example, asking the list questions on the mobile phones, and what hurdles, if you've already done it, have you faced by using the different platforms?
Thanks a lot, Aditi. So with the list questions, there's a lot of literature coming out on this now, including a paper that I listed in one of the things called, I think, Sex, Lies, and Measurement. So they talk a lot about the different composition of the non-sensitive items. It's because it does really matter what is in that. JB and I and the team in Rwanda and my team in Nigeria did a lot of piloting. So it's really worth investing and not underestimating how much piloting you need to do in advance to get in a really similar sample to your sample of interest, getting a sense of the prevalence of each of the non-sensitive items that you're not interested in, so that you can then form the right composition. There's some good design advice in other literature that suggests that you need to have them inversely related, so that essentially what you're trying to avoid, what you need to maintain is anonymity. So you can't have many people at all being put at the ceiling of having the 4 sensitive items as true, because then their status on that item is known to the enumerator. So really the objective is to get have like a sense of, minimize the ceiling effect, I have seen some literature suggesting that maybe it's useful to shoot for like 1.7 as your mean in the non-sensitive group. I can't quite remember, but yeah, that's worth thinking in mind about the ceiling effect. And then there's mixed literature on the right way of having the non-sensitive statements as being somewhat sensitive. So I think in that Chuang et al. Paper from this year, Sex, Lies, and Measurement, I think they find that if you have a non-sensitive, if your statement of interest is mixed in with other sensitive statements so that your item is like hidden, I think that one increases people's willingness to report. Whereas if you have non-sensitive items, like in the example I showed, so that the statement of interest really stands to be quite different, that doesn't result in quite as high reporting. Now it would be worth seeing which is closer to truth. But yeah, I guess I don't have an answer. It's really not known what is the exact right way you should comprise those non-sensitive items. And I guess you don't want to cognitively tax people too much. So it's probably, so you have to think of things that are not going to be correlated with the treatment if you want to measure this as an outcome variable. And something that's widely known. So we tried month, I think in Rwanda, I don't know, JB, if you remember, but I think we asked, is this February? And not everyone knew that it was February. So things like that will come out in piloting. Sorry, that's a long list. Hopefully some of that is useful.
Thank you so much, Claire. We're going to go next to Goldie Dhamaban, who I think is joining from a research institute in Indonesia. He wanted to know that before the implementation of Akasi, do the interviewer have to meet the respondents in person? If yes, how much effort do the interviewers usually need to build this rapport? If no, do you think it would be useful to do it in a remote survey considering the COVID-19 pandemic? So it's actually both, like in terms of practically, do you have to build a rapport with the respondents before implementing Akasi? But then also I think almost a second question about thinking about how to implement this in the current situation. So maybe we'll take it in two parts. If you could just answer the first one, and then we can also have a discussion on what the implications of COVID is for these methods.
So maybe I can take that one. So I think for Akasi, it's really useful for that enumerators or data collectors meet the participant, especially because of the literacy level. We're not sure that everyone can really be comfortable to use a tablet, headset, and do it by himself or herself without any contact, so that people can show them how to use that. So it's definitely really important that data collectors meet respondents on the field. And in order to create the report, it's always good to have enough practices before allowing respondents to use Akasi by their own. One of the good practices to do when trying to bring this participant up to the speed of using the Akasi by themselves is first to introduce them on how the asset works, show them how the tablet works, how the headset works, show them how to increase the volume, how to reduce the volume, how to replay the questions in case maybe they didn't get it very well. It's also good to have some practice questions so they can play with those before they actually start the real survey. And it's always good to have those questions in a way that is really similar to the actual interview question. For example, if people we have to play with colors, have a practice question around the colors. If people we have maybe to select shapes, for example, if there are some shapes in form of star, square, make sure people understand the difference between a square and a star. So it's always good to have someone work the respondent through some practices before they can answer questions on their own. And a good practice again around this is to code those practices in a way that will give you a notification that tells you this respondent passed the test or he failed the test. You need maybe to repeat the practices again before they can actually go and answer the question on their own.
And Mahreen, I realized I forgot also to answer the other COVID question about list experiment from Aditi before. So I might just chip on that one now. So I guess list experiment, I don't know, from JBM, my experience, I think it's depends on the numeracy and literacy in the population that you're working with, but list experiment is complicated and quite unfamiliar to most people. So I think that would be a real challenge in general, unless maybe they were familiar with it from baseline pre-COVID or something. I think it could be challenging. It does have the advantage that it does mean that you have anonymous responses. And so some, for example, on IPV research on intimate partner violence, I've seen some study, I can't remember who the authors are, but it suggests that doing phone surveys during COVID, when they were asking women about who was in the room with them, that very frequently mothers-in-law and other family members were in the same room as women who were answering the phone survey. And in that case, you can't hope to get a truthful response to sensitive questions like their experience of intimate partner violence. And so at least the list experiment does mask responses, but I just think it would be really difficult to administer. And also there are some ethical questions about using the list experiment and referring women to services. So it would be tough. I don't know what you both think. Maybe you have experience during COVID, Jean-Baptiste and Mahreen.
Yeah, so I agree with you that I think it's quite hard. In fact, we can actually maybe also have Adeline Lees, who has a similar question, ask her question to weigh in as well. I think she was also worrying about reporting bias, but Adeline, you were unmuted, if you can go ahead.
Hi, yes, thanks for the presentation. I work with the International Center for Tax and Development, and we're doing some survey work on tax attitudes during COVID-19 in Rwanda at the moment. And obviously due to travel restrictions, we can't go there, and we also can't meet our enumerators and train them ourselves. So we've been doing phone interviews, and we don't, I would say, like, we're not asking questions about tax evasion, so it's not as sensitive as that, but still tax attitudes are quite sensitive, you know, whether you trust the revenue administration, that kind of thing. So I wanted to know whether you've got any experience or views on difference in reporting bias between a phone interview and an in-person face-to-face interview.
For me, I have not seen those comparisons. Yeah, admittedly, I haven't done phone surveys before, so I'm probably not the right person to ask. Yeah, so sorry about that one. JB, I don't know, have you used phone surveys during COVID yet? And do you have a sense?
Yeah, we did a few phone surveys, but not on sensitive questions like this. So I don't think maybe this can really be very useful to be used on the phone survey, because some people may need like very, very clear clarification in person before they open up to you. So I don't think anyone can feel free to say his problem over the phone. So I think the phone survey is really good for topics that are not really sensitive, but when it comes to sensitive topics, it can be hard, I guess. Yeah.
We have a lot of interest in phone-based questions, actually. Lucas Hensel, who's from our lab, is also asking a similar question. Lucas, do you want to?
Have you done them? Sorry to throw it back to the panelists. You've used phone surveys?
I have not actually, no. So I've thought about it, but the problem is that, especially if you're worrying about their safety, I think it becomes really hard to ask the question. So this is in the context of intimate partner violence. So we actually then went with the approach of asking what their perception of village level violence rates is, which we think is less likely to cause them personal problems, but still pick up at least at the village level. So this was in Uganda. I have a study with MRI there, and we wanted to pick this up, but we were conscious that if we asked the woman on the phone, this might pose problems. There's, of course, you can think of ways where you tell them to punch some numbers in the phone. This hasn't been tested. So you could adapt potentially Akasi to be that format, like 1 is a lot, 2 is a little bit, 3 is never, and or start by asking them, are you on speakerphone or not? Because I believe that they found this in a study in India, that a lot of women were actually asked to be on speakerphone by their mother-in-laws or others around them so that they could know what they're talking about. So of course, first establishing that they're not on speakerphone, having established that to not pose them any risk of saying out the answer aloud, asking them to punch those numbers in on their phone. That is one option. To my knowledge, this has not been tested, but I think this could be a smart idea, especially if COVID drags on and we are worried that we are missing out on incidents of violence or violent spikes because we're just not measuring it. But in the absence of having piloted that method, we actually went with the approach of asking, in your village, how often do you think a man hits his wife? And we did see, by the way, quite a sharp increase in that from pre-COVID to post-COVID levels. So we think we were able to pick up something about what was happening in these villages, but of course we don't know about individual experience.
And maybe that works for tax and other things too, that people might not feel comfortable. Like perceptions of out of 10 people who live near you or in this village, how many of them do you think believe X or something?
Sorry, Lucas, to have kept you waiting for so long. Do you want to ask your question now?
Yeah, thank you. This has been great already. I really learned a lot. So I think I'll go with my second question, if that's okay. So most of the discussion so far is focused on binary outcomes. It's my understanding, in particular, the list experiment requires binary outcomes to be measured. So just simple yes or no questions. In my research, I've experienced that firm owners are quite reluctant to tell us their profits. And that's something that we have to deal with. That caused us quite some trouble. And I was wondering if you have any idea of how one could elicit continuous measures, continuous sensitive measures without getting very high refusal rates.
So I don't know, maybe JB can talk about Akasi, but I'm pretty sure in Akasi we measured Likert scale outcomes. So I don't know if you have used Akasi to measure continuous outcomes so profits or other things where people put in numbers otherwise I don't remember the content of this study, but I do know that Cullen and Zinman have a paper on using the list experiment for measuring something to do with microfinance loans. I'm not sure what they were doing, but otherwise measuring sensitive continuous items. I don't know of other reporting methods for that. JB, have you used Akasi for other things on other studies? Just Likert scales and obviously, yeah.
No, we haven't so far.
Okay. I think we asked about maybe alcohol consumption, but using Likert scale again. So about frequency of alcohol consumption on Akasi.
Okay, thank you. I see, Alina, you have another question, so you can ask that now. And if anybody else has questions, I see a lot of our lab people are asking questions. They're super interested in this method, but I don't want to give them time. So if others have questions, we'll give you priority. So Alina, if you want to ask your other question.
Yes, hi. So for Akasi, I was just curious to know if all the answers would be something based on options, so they choose, or would there be some questions where they need to answer themselves and record their answers? Because if they need to, I'm assuming there are going to be implications. So yeah, I just wanted to understand that.
So for Akasi, I would recommend having option to be selected for 2 reasons. First is the heaviness of the data. Usually when we are using Akasi, even the audios of the audios for the questions and answers are too heavy at the point that at some point we can't even download those surveys when we are in a remote area. So having the answers in a form of audios again can make the data too heavy. And again, respondent may not feel comfortable to share their voice, because they may think that maybe someone will recognize me, will listen to my voice and know that it's me who was saying this. So so far we've been using Akasi in a way of having respondents go through it and selecting options. And again, the best practice is to make sure they really understand how it works and give them practices of possible options that they will encounter in the actual survey and see if they can recognize that. And if they can't really manage to use Akasi on their own, after many practices and supervisors support, that time, in that case, maybe one animator will have to interview the respondent face to face. But it's really important to prioritize the practices. Yeah, I think that's what I can say on that.
And also, Mahreen, I might just share my screen again quickly. We have, so JB and I have a picture from, that might be helpful to show what a screen looks like on Akasi. If so,
people very helpful, yeah.
Yeah, maybe that's good. Can you guys see that? See my screen? Kind of?
Yes.
Cool. Yeah, so these were, each of these were the answer options. And then people have to listen to the question, it plays automatically, and then they pick their answer. So they don't have to be literate or numerate to understand.
That's helpful. There's another question, and I have a linked question to it. So is there any qualitative work that you would really recommend before implementing these questions? And I think particularly worrying about the reliability of the data, that it's being misunderstood and hence you're getting these questions, the responses rather than, yeah. So how do you unpack misunderstandings from actual misreporting that was happening because when you were asking face to face?
I'll just mention one thing. So I guess like all good survey practice is lots of piloting and probably cognitive interviewing at the beginning to like sit with someone and understand what is going through their head as you're asking them these questions. And then I don't know, JB, I remember some things from when we were doing like enumerator training, and the enumerators spotted some words where the word beating in the way that we'd done the translation from an IPV question was extremely sensitive and really had strong connotations, more than we had intended in the English version. And so we changed the word from that. So I guess it's just related kind of things to understand the implications of the words that you've translated, and cognitive interviewing to understand how people are interpreting the questions. Yeah, and then the tips JB has already said on how to make sure people are understanding the method. It's all from me. I don't know.
Yeah, I was going to also mention that it's really important to do many pilots as possible, and especially doing those pilots on the actual respondent who have the same characteristics as the sample that you are going to interview, and also to have enough practice questions before they move to that part where they will be answering on their own, and have that practice, have practices that are quite similar to the question that the survey has.
I found that very useful as well in Kenya, which is to actually do it stepwise. So first ask them to identify the shapes in case there is some issue and they don't understand what a circle or a square is, and then to not move ahead and just be like, simply, can you select the square or can you select the circle? And then be like, okay, select the yellow circle. So then you know that they're also associating the correct colors. And then with the choices that, can you select the yellow circle, which is for if this happens a lot of times or it never happens, and to do it for each choice, which then obviously means that it's quite taxing in terms of time. So if you're very restricted in a general survey and you want to integrate Akasi into it, I haven't done list ever, so I can tell you about Akasi, but I think that was my one big issue with Akasi, that it's very helpful, but then it takes up a lot of survey time. And you should be it should be a priority of that survey in order for you to do it. But if you're asking, let's say, a lot of household surveys are now also asking questions on intimate partner violence, which is great because we really need to know about its prevalence. But then it becomes a little tricky because you have to spend a lot of time in the practice rounds, and handing over the tablets and the headphones and explaining to them is quite a concrete chunk of time. I don't know what the way around it is, but I wouldn't really recommend doing it without practice rounds. I don't think doing it quickly is a good idea. You have to spend a little bit of time. So please bear that in mind if you want to use Akasi. I'm mindful of time. We have another question from Farah Said, who was the panelist on our first webinar. So if Farah could be unmuted.
Hi, thanks both. This was really informative. So this question might be a bit basic, but I've never conducted list experiments, and I was wondering if there's any best practice for the number of questions to include, or is that just determined by how much time you want to spend? And then related to that, is there any guidance on how many sensitive items to add, or is that again only one?
Thanks a lot, Farah. So in terms of the number, I haven't seen a study that has looked, I can't remember if the sex, lies, and measurement paper compares the number, but standard is between 4 and 5 items on the sensitive question. So either 3 or 4 non-sensitive ones. And there's just like some variance questions that you'll be thinking about there. In terms of, I have not used the double list experiment, but it is worth looking at that method, as I think that reduces the variance a bit. So yeah, I haven't used it myself, but look into that one, I think. And then just another question, I realized I didn't ever say this from Mahreen's question, is that we did, to try and understand if people are understanding the list experiment, I haven't seen a study on if this has an impact on the way people answer the question of interest, but before we administer the question, we do like a test question, like it is sunny to, it is like, I am wearing shoes, Abuja is the capital, and it is February or something like that, where the factual outcome. And so the enumerator will have a sense from their correct answering of that question of whether the respondent understands the list experiment. And so then from then on, they can respond by like either re-explaining the instructions or proceeding. So that's one option you could do to give the enumerator a sense of whether the person understands it. And then I guess there's an open question about whether the person is worried that will affect how they answer the real question.
Great, thank you. That's actually really very helpful. As I said, I've never done list either, so that's something to keep in mind. Very helpful. And I think you can also, with Akasi in particular, ask the enumerator to record if they thought that the respondent was having trouble using the system. So, and then maybe drop those observations and do robustness checks. We did that in Kenya, and it was helpful to know if there were particular participants that really needed a lot of help. We're in the last 5 minutes, very quickly going to the last 2 questions. So Godfred Anako, Godfred wants to know, how do you ensure the representativeness of the general population in phone survey under randomization, since some socioeconomic characteristics may make certain groups more responsive on phone surveys than others? This is actually a more generic question than on Akasi or list. I don't know if Claire or Jean-Baptiste, I think absolutely this is a big problem because mobile ownership is thought to be very correlated. You do try in surveys to take backup numbers so that you can still reach the respondent and try to remove that bias, but you can also reweight in your estimations. And that allows you to ex post change the weightings of your estimates to make sure that you're representing in the right proportion people who didn't have a mobile phone. Any other thoughts, Jean-Baptiste, from your experience of implementing phone surveys during COVID?
No, not in particular. I think you covered most of it. Yeah.
Okay. So a final question from Shanze Khalid.
So I just wanted to ask about the actual setting when we do like a list experiment. Is the idea that we do one respondent at a time, or do you think it's also possible to do it in small groups where they report the answer back to us at the end, something like that?
I'm not sure I understand. So are you getting an individual answer from everybody, but it's just that they're sitting in a group of people, so other people are around while they're answering it?
Yeah.
Yeah, okay. I haven't administered one like that. I guess it depends on the sensitivity of the question maybe, so, and the context. So I've only used it for intimate partner violence where it's extremely sensitive. We're already sitting in very private locations, like in a classroom by yourself with the enumerator. In a group, I guess if it's not, intimate partner violence has very strict ethical protocols, as you can imagine, but maybe for other questions, that could be feasible because it is anonymous. Yeah, I guess it would depend on the sensitivity and the ethical questions about your issue that you're studying.
Right. So what we had in mind was actually questions related to COVID and symptoms, etc. So maybe definitely less sensitive than IPV, but yeah, maybe we should also think about doing it individually then.
That's interesting because I guess it could save time of,
yeah.
It's very complicated to explain. And then I guess it's also worth thinking how embarrassed people would be to admit that they didn't understand it because it is complicated. So yeah, I guess maybe pilot it a bit and see how people understand it to begin with. But yeah, interesting.
Yeah, okay, thanks.
Yeah, that's a really interesting point, Claire, there, that if people are hesitant to tell you that they haven't understood because they're worried about what others will think. And in an LMIC context, I think it's even more important. People don't often speak up in groups of people that they know and fear being judged. On that note, I think I'll wrap up. Thank you so much, Claire and Jean-Baptiste. This was really, really very helpful. I definitely learned a lot about LIST, which I'd never implemented. And I think, especially when you start thinking about implementing them, any technique, you sort of start from scratch. So we're really hoping that the Measurement Matters posts on our website, which I said we have a post on Akasi on the Mind Behaviour Research Group website. And this webinar will be posted on YouTube very shortly. We'll tweet about it as soon as it's up. This can be a resource for you to go back to when you're thinking about implementing this. So thank you so much. I hope, and thank you to all the participants for their questions. Goodbye.